I'm Dr. Alan Perel, and this is Conversations in Medicine. This program brings cutting-edge medical topics to the Staten Island community. Today's program is about multiple sclerosis. The Multiple Sclerosis Center of Staten Island is celebrating its 25th anniversary this year, and I've brought on this panel the people who help make it run, the healthcare professionals and the people who help the people with MS. I'd like to make some introductions. Over here is Carla DiToronto, who's our practice manager. Madeline Buchanan, our physician's assistant. Debbie Monero, the office manager. And Kara Hitt, our authorization specialist. Thank you all for coming.
Thank you.
I'd like to talk about MS a little bit. And MS is a neurological disorder. It's a disorder that affects both the brain and the spinal cord. People with MS have various neurological symptoms. They can be blurred vision, dizziness, problems with walking, bowel and bladder symptoms. Because MS is an immunological disorder, meaning that it affects the brain and the spinal cord, and your own body is attacking something that it shouldn't be attacking, namely it's attacking itself, different symptoms occur in different people. As we said, some people have blurred vision, dizziness, walking problems. Everyone is different who has MS, and that's the same as any disorder in the world. Some people will describe more problems with their walking, others more problems with their vision, others with more problems with their bladder. MS has been recognized as an entity for about 150 years. We had no therapies for MS until 1993, so it's been a little over 20 years. We now have 13 different medicines for MS. We are in the midst of a tremendous amount of research with MS and education. Our new treatments have changed the prognosis of people with MS. Before disease-modifying therapy, people weren't doing well. Now people are doing exceptionally well. Not in every case, and again, just to give one statistic, back before medicines were available, if you were diagnosed with having MS, the risk of needing a cane in 15 years was about 50%. Now it's about 1 in 10 people. This year marks the 25th anniversary of the MS Center of Staten Island. New cutting-edge improvements, new medications, helping people walk better, disease-modifying therapies, and symptom management is now becoming more and more available. There are over 500,000 people in the United States with MS. We are not yet at a time where we have a cure. Hopefully we're getting there soon. So it's my pleasure to introduce and bring back our panelists and really to talk about how taking care of people with MS may be different than other neurological disorders. As a specialist in neurology and a subspecialist in MS, maybe we could talk a little bit. So what's your impression of an MS center, Madeline? What components are there and what things are different?
I think the benefit of an MS center is that it really offers comprehensive care. So we have relationships with different specialists that someone with MS might need, whether it's a urologist for bladder issues, ophthalmologist for their eye issues. We have relationships with rehab centers, physical therapy, occupational therapy, and it just makes it easier to have everything that an MS patient might need in one center.
So Debbie, tell me, when someone contacts the office and they have MS, is there anything different about them than other people and how they're treated at, say, a center, or just in general?
Well, we don't really treat them any different, but we do have more resources for them that we could go, like Madeline said, that we could refer them out to different people that could assist us with their issues.
What I'd love to go over is some anecdotes or things that really has been special. And when we talk about a center like ours, what kind of things are different? I mean, Carrie, you do a lot of work with getting things approved and really getting people the things that they need. And people with MS oftentimes will have different needs than other people, whether it's for handicap parking or wheelchairs or things like that. Do you have maybe you can tell us just some ideas of what you do, and really, in a lot of ways, talk to the community about what goes on with the doctor's office. A lot of it, we're talking about specifically about MS, but really in a physician's office in itself. What kind of things do you do, and maybe navigate somewhat the system?
Well, after initial diagnosis, we do MRIs annually. We speak with different authorization departments, either on the phone or online, submit your clinical picture, evidence of changes, get the approvals that you need so that patients can get the imaging that they need and we can stay on top of the progression. In some cases, it's important to assist a patient with items they may need to help them get around to perform their activities of daily living. For example, the paperwork involved in getting a motorized wheelchair is very specific. It involves phone calls to insurance companies, to medical supply companies. We review each patient's chart, answer a detailed set of medical necessity questions, everything from your height and weight to your ability to ambulate and self-care. And once we get all the required materials, the initial request is put through and we follow up on it for the patient.
Carla, as someone who's dealt with clinical practices for many years, tell me a little bit about the team approach. I mean, you've always preached that in our office, and I know you work in different offices on Staten Island and throughout New York City and New Jersey. The team approach, when we're talking about an MS center, but, that's part of it. But I actually want to bring to the community, or bring to the people who are watching us, what ideas, what goes on in a doctor's office a little bit, how things get done. It's funny, if I go into my doctor's office, I have no idea. Someone gives you a prescription. What's the process that gets done?
Well, there's a lot of things that go into it, and it begins, of course, with you as the physician and your PA. But there's more to this. There's going to be bills. There's going to be insurance issues. And it's difficult enough if you're ill. Now you have to navigate how to get your insurance to pay for the things that you need. And the patient and the patient's family really need that assistance. We automatically think insurance pays for everything, and it doesn't, unfortunately. And I'm very proud of the fact that we do have a team approach, which means that our patients are taken care of medically by you guys, and then you pass them through to us, and we can help them get through all the difficulties of their insurance so that they can get the medications they need, get the wheelchairs they need. And it's very, very difficult. And it really creates a lot of anxiety for the family and the patient. And that's the last thing they need.
And Madeline, when we start talking, so Carl was talking a little bit more about what's going on in the team approach with regard to the staff and getting things done efficiently. In New York State, as you know, we now have electronic prescriptions, things that, and Kara was talking about getting things approved. Medically, in a sense, if someone comes into the office, maybe you could just even describe what's a physician's assistant?
Okay, so depending on the specialty, PAs do a lot of different things. I'll talk about basically what we do, the PAs in the MS center do. Most of our day we are seeing a bulk of patients. I think the great thing about what we do though is we have more time to be able to kind of educate the patients, answer their questions. If they have any issues when they get home, they give us a call, and we're more than happy to, go through what they need, whether they need to come in or we can just put a medication through. So I think we're a good, we facilitate basically any issues that they need.
And that's so important. In any practice right now, having the healthcare professionals, the physicians, the registered nurses, the nurse practitioners, the PAs, all really being on the same team is so important. And that's what allows really access to care. Yeah. So if at night there's a doctor covering, one of our group covers, or during the daytime if somebody has an emergency situation, they're able to really get into an office much quicker. And I remember when I first started in practice a little over 20 years ago, it was very hard to get an appointment because it was be one individual. Now with a team that's educated with this, it really makes a very, very, very big difference. Maybe we could even talk a little bit about what the registered nurse, a lot of RNs work in MS and in doctors' offices now. So what kind of things do the nurses do?
The nurses are another crucial part of the team in the sense that, at our center, the nurse is, when we have patients who come in every month for certain infusions, she's the one seeing them every single month, helping them get their medicine. And the nice part about the nurses too is they almost act as a liaison between the patient and us, because if there's any issues, they're seeing them every month. And the patient will, tell the nurse, listen, I have a question about this. She'll come up to either the doctor or the PA and say, what do you think about this? And we could either say, you know what, it's a simple fix, or come on in, we'll talk to you about it. So they're definitely another crucial member.
Let's talk a little bit about MS as a whole. We brought some slides because I always like to look at some pictures. And we talked a little bit before about what multiple sclerosis is. When I was growing up, when Jerry Lewis had his telethon, there was a disease called muscular dystrophy. And people always used to confuse the two. Now, with muscular dystrophy not being as well known, or we don't talk about it as much, which is a disease of the muscle, that's totally different than MS. MS is a neurological disorder that affects both the brain and the spinal cord. So if you look at the slide that we have up here, basically it says that about 400 to 500,000 people in the United States have MS. Women get MS about 3 times more commonly than men. And it's an immune disorder or autoimmune disorder, meaning that your body attacks itself. Other autoimmune disorders are things like rheumatoid arthritis, where you attack your joints, or psoriasis, where you attack your skin. So there's a lot of different things that are autoimmune or immunologically based. Women get autoimmune processes much more commonly than men. There's a lot of reasons because of hormones. And in our next slide, we're showing really what the nerves do. What nerves do is send signals, little electrical signals from one nerve cell through a long cable down into another nerve cell or into your muscle. That's what allows my finger to move like this, because I'm actually thinking about it doing it, or if I change to this finger or I'm speaking. Now those signals go very, very quickly, because think about how quickly we run or move or talk. Sometimes because of MS and in patients with MS, the signals aren't going as quickly because the nerve cells are disrupted by this inflammatory process, meaning that the immune system is attacking the myelin or the covering of the nerve. In that case, the signal is slower, or the cable itself sometimes is not normal. How do we diagnose someone with MS? Diagnose someone with MS clinically, based on what they describe. Also, we use ancillary tests. And on our next slide, we have a picture of an MRI. And those white dots, with the red arrows pointing at it, those white areas are areas of inflammation in the brain. And why, in the old days, all we used MRI was for diagnosis. Now we use MRI sequentially to see if someone is doing well. And nothing is ever absolute, but even if you're doing well and your MRI is getting considerably worse, you're not on the right treatment. And that's another very nice mechanism we have in order to treat people with MS. We have both their clinical findings, how they're doing, examining patients, asking how they're doing, and also looking at MRIs and other MRIs specifically to be what's called a biomarker of how someone's going to do. So we've come a long way. Initially, we had injections for MS. Now we have injectables, pills, higher efficacy infusions, intravenous therapies. They're all in our armamentarium. And that's really what's brought us all together. I mean, that's why I had this event here this evening. In a sense, this program here is to talk about if you have MS or you have a family member with MS. And here's an interesting number. About the number of people who have MS on Staten Island is about 1 in 800 people. There is a genetic component to it. So if you have an identical twin with MS, your risk is about 1 in 3. So that's a lot higher. So the idea of that there's a genetic and environmental component to it, and how common it is. And if you think about it, it affects women more than men, usually between the age of 20 and 50. So that's why centers were set up. So what I'd like to now go back to the team a little bit, and that's really what this whole thing is about, is that you need a team approach. There's never a place where one individual person can take care of everyone. It takes a village to help raise a child. It takes a lot of people to help take care of someone with MS or any neurological problem. So Debbie, back to you, as someone who runs the whole place. Tell me, you get calls every day from both patients with MS, people without MS. Tell us a little bit, are there any stories in particular of ways that you've gone out of your way or used the system to try to help people, especially our patients with MS who have problems sometimes with heat, with walking upstairs, with work conditions, things like that?
What we do is we try and educate them on what they're actually entitled to through the city. We help a lot of patients obtain Accessoride because they have difficulty traveling alone. And a lot of patients don't know that these are city programs that are available to them. We also helped some of our patients after the Superstorm Sandy because they have difficulty walking up steps, so they had to rebuild their house to accommodate them with their walkers. We also assist patients who live in public housing because they don't have air conditioning there or sometimes in their workplaces. So we write letters and try to advocate for them so they could obtain air conditioning.
And all those things are important. And you think about it, the idea of the whole person is not just the person who comes to your office and what you do. It's being able to have, if they want to work, you have to have a place air conditioned because temperature, being too hot, sometimes triggers or makes MS worse. And actually, in some people, being too cold also does that. So it really puts that all together. Carla, you're an expert in insurances and what the government is doing. And I've always used your resources so much and really respect them and appreciate them. Different times of the year, people in the community, whether they have MS or not, I really want to generalize this a little bit. What should they be looking for in which insurance they should get? And I think that's important, especially with people with any chronic illness. And what would you recommend?
Well, one of the things we have to keep in mind is, and you were talking about stories, it brings to mind where we had a patient who was using the incorrect insurance, and it was a government plan. Through no fault of his own, he just didn't realize it. Now we have to make sure that we're doing it right too. So we need our patients to bring us the right information. Patients need to look at the formulary especially. If they have any kind of an illness, the formulary is a list of drugs that their insurance company will pay for at different levels. The bad part is the insurance company can change that formulary in the middle of the year, and the patient has no recourse. So that becomes a huge issue. So one of the things I always advise my patients to do is look at the formulary when you're ready to choose an insurance plan so that you can make sure, at least to begin with, that it's going to cover what you need.
Right, and clearly you want to make sure your doctor's on that insurance plan.
Absolutely.
Make sure the hospital you're near is on that plan,
Yes.
the medications. So Kara, a little bit of that, we try to always bring people into this. Any thoughts about any episodes or any things that you were able to do in the recent past, whether someone with MS or not, in order to go through the system and get them what they need?
Well, I think it's important to stay in touch with the patient. You know, we work with them as kind of first line of defense when they get their MRI and they contact me. We try to find, with the help of the physician and the physician assistant, the best drug for them. And we work with their insurance company to tell the insurance company what they've used in the past, what symptoms they're having, and what is going to work most effectively for them.
So there's a whole checklist. So you have to know your information before you call.
Correct.
And interestingly enough, a lot of times we'll want MRIs in patients, and sometimes they'll say they've had them too soon or they really can't approve them. I think sometimes our arguing with them, if Madeline, the physician assistant, or myself gets on the phone, usually it works a little bit better if they're reasonable, if it's a reasonable request.
True. Most insurance companies, all insurance companies, will give you an MRI one time in 12 months. Based on your symptoms, based on changes, based on the effectiveness of your medication, we can put them through sooner. There are some medications that would like you to have the MRI every 3 to 6 months. And we work with the insurance companies and the patients and the physicians to get those approved.
And it's key to work with the insurance companies. It's not adversarial.
Exactly.
No, it's not against
and that's the
them.
most important thing, is to be able to do that kind of thing. Debbie, you were telling me a story a little while ago about a motorized scooter. But maybe tell everybody, how do you get one of those things?
It's a lot of review of the patient's chart and a lot of details. I believe me and Kara worked together on that.
We did. We did.
So we reviewed the patient's chart, and we spoke with the company also that needed the motorized scooter that was providing it, and they provided us with the information they needed. The patient's chart was very large, but we went through the entire chart to provide them with all the information that they needed. And like Kara said, it does get very personal to the patient, you know, because they need to know what they're able, you know, what they are able to do and what they're not able to do.
And from the insurance company's standpoint also, they want to know how that scooter, how that device is going to improve the quality of life for the individual.
Any other examples, in a sense, because you guys are doing so much, and I want to get the feeling to the people watching, is how you know your patients. I mean, patients, people who come into the office, I mean, they all have no qualms about calling, about getting involved, and you getting involved, whether it's for jury duty, handicap license plates, things that really are at disposal. I know you've also had some contact with the National MS Society, and they've really done a lot of important things for our people with MS, but we've been able to generalize it to some other things. Is there any advice with regard to, you know, using resources like the support group and the places in Manhattan and the national organizations to help some of the people? I mean, Kara, when you have people who can't get an MRI, are there any other mechanisms of getting it? I mean, I've heard of some groups called MSAA where they might be giving out medicine and be giving out MRIs, you know, whether it's working with the pharmaceutical industry to try to get a patient on a medicine.
I think
Tell us a little bit.
The biggest part is not to be afraid to say what you need, not to be afraid to say, well, they didn't approve my MRI, but I really want one. I really don't feel good. I really do need this medication. What can you do? Can you get me financial assistance? Can you get me a service dog? Can you get me something to help me? I can't wash my face anymore. I need to sit down while I do it. If the patient can't do something, they need to communicate with us as well. That goes a long way in helping us get them the services that they need and let them know what's available.
And people are doing better and better, and that's the important thing, that we have so many new therapies. We actually do infusions even in in the office, at our center, in order to try to get people the most effective agent we can. So the doctor, and maybe I'll go back to Carla, the doctor-patient relationship, you always tell me is the most important relationship in almost anything.
Absolutely. I mean, no matter what we do, and I'm very proud of the way our center works, because even with Kara, her group always makes sure to stay in contact with the patient, for instance. If the patient doesn't make an appointment for the following month when she knows they should be here, she's on the phone contacting them right away to make sure everything is okay. Our job is to allow you to practice medicine. That's really what it is. We try to pick up all of the parts that make it easier for you to have that relationship for the patient, because that benefits both you and the patient, and that's what our goal is. And the MS Center, by the way, gives the patients the opportunity to talk to each other, which is really important because they can empathize with each other as well, and that opens up channels too.
And that's so important. Maybe, Debbie, you could talk about when we give Tysabri, or a medicine that we use for MS. Tell us about the groups and what they do and how they want to go together and how they build bonds.
They've actually made, a lot of them have become very close friends, and they want to be there together. They also, like, when they don't feel well, they explain to each other how they feel, and then they know to come and tell us.
So Tysabri is given over a 2-hour period through an intravenous. It's a very potent medicine, one of the medicines for MS. And we give that in the office, and we have, 4 or 5 people at a time, 3, 4, 5 people being given the medicine. And what do they tell you? I mean, do they all want to come at the same time?
Yes, they all want to hang out together for 2 hours. I mean, we've even gotten closer with a lot of the patients because they're there every month. You know, you build a lot of personal relationships with them because they spend so much time at the office as they do with each other in the infusion room.
Tell me a little bit, if someone comes into the office and has a problem with walking, is there any accommodations? I know we have an elevator or a ramp, things like that. And again, with the ADA Act, I mean, it's a shame that a patient can't be comfortable. They really should be. They should be able to get into a place properly, get onto an exam room table, be able, if they can't see, be able to have someone help them fill out their forms, or if they've got problems with writing. How does an office, how do you run that? How do you make sure that if someone comes in, they feel comfortable?
Well, we always make sure we have people around that could assist the patients if they need help either walking or be assisted in getting lifted, or if they do need help filling out their paperwork. We have some young people in the back that are always ready to assist the patients.
Those large young men from college, or, who are able always to help us out. But we try very hard.
We do. We try to accommodate everyone and make them feel comfortable.
And you do a marvelous job doing that. Madeline, tell me a little bit. We talked about our interesting patients, and we really review our patients almost on a daily basis. Any specific stories or anecdotes that you could talk about with regard to what patients need and how a center, and even a general neurologist's office, or even a general medical doctor's office, you really don't have to be of that level, how things that you've learned in your few years of being a physician's assistant has helped bring together, a better outcome on someone?
I think one of the important things is when we see these patients, like these ladies are wonderful at helping us, like Carla was saying, where they help us do our job. And I think from a clinician point of view, besides obviously, the scientific medical issues, I think it's important that when we, really listen to the patients, sometimes they have a lot of comorbid, like other conditions. We have a few patients in particular who unfortunately, in addition to MS, they have some sort of cancer. And sometimes all they want to do is talk on the phone for 20 minutes, even if it has nothing to do with MS. It makes them feel a little bit better, makes them, feel that, okay, at least someone's listening to me. And honestly, I think that besides all the, the training we get in medicine, I think that's a crucial part of making the whole patient experience better.
And that's
some compassion.
absolutely, and that's what's so important. Even though we're not primary care physicians, we don't take care of people's colds and things like that. we still are the hub of people with MS's
Exactly.
care, and that's really what's so
You
important.
really
And
are.
we give them their advice of where to go and what doctors
Yeah.
to see and what's going on. So let's go over a couple of myths about MS, and we'll talk about that. I'll ask you with me. Can people with MS get pregnant?
Absolutely.
Does it affect their MS?
It does affect their MS, but it's absolutely possible. We work with the obstetrician, whether we have to tinker with some of their medicines or maybe give them a different dose of medicines. We have many patients that get pregnant without an issue.
And as you know, it's an immunological disorder, and during pregnancy, your immune system is actually a little bit dampened. So people during pregnancy, MS patients during pregnancy, actually do a little bit better. Then we have to do some things after that. Could people with MS work?
Of course.
I mean, the issues that people sometimes don't work is because of the fatigue, which we see in about 95% of people with MS, sometimes some cognitive problems. Debbie was talking about temperature. Tell me about temperature. What kind of temperature do people need?
Usually cooler.
Cooler is usually better, but some people don't like it too cold.
No.
Some people don't like it too hot. And that's where we try to have people with air conditioning and
Yes.
things like that in order to do it, to be able to be more,
Keeps
to
them
function
comfortable.
better.
Yeah.
And what's interesting, one of the treatments for the fatigue, we have medicines for fatigue, but sometimes the best treatment for fatigue is just taking a nap, is just really trying to do things like that. So Madeline, so say someone comes up, and MS, as we talked about, is something, this immunological disorder that comes in flares or attacks. And if someone has an attack, it means that they have a new neurological symptom. They're weak on one side or they're blurred vision. What happens if someone has an attack? What should they do?
Obviously we encourage our patients when they have an attack to either give us a call, and then usually we have them kind of come in to assess the situation. Like you said, it's a change in neurological status, so if we have a patient who usually has a little numbness maybe in their right arm, and then all of a sudden they're getting double vision, a little urinary incontinence, that's usually considered something that we like to treat with IV Salumedrol, a medicine to kind of just help those symptoms kind of resolve a little bit quicker so we can get them back to their baseline functioning.
And that's what we try, and we get people in the office as soon as possible to try to avoid going to the hospital. Karen, a number of other members of our staff, Samantha specifically, helps get intravenous therapy done at home. And that's a big deal, that someone doesn't have to leave their home. They can have the treatment done at home, something called a steroid, which is an anti-inflammatory drug. You guys all work together to get that all done. And that's really so important, to be able to keep everyone comfortable. As Madeline said, many times people with MS have other problems. And really to be able to handle those other problems, try to get the right treatment, the right medicines. So we're coming up to our last few seconds. You guys have any closing remarks? What do you want to say to our patients? Debbie, what do you want to say to everybody?
They know we're always here for them, and they could call our office anytime, and we'll always be there to take care of them.
What a wonderful thing to say. Neurologically, we're getting closer to a cure. We only go in small steps. It's a privilege to be running this MS Center for 25 years now, which we're going to be celebrating our anniversary this year. And the only way it works is with these wonderful people here and the wonderful people at the MS Center. There's over 40 people who are working there. And each and every one is crucial in order to have a successful outcome for a person, a patient, a mother, father, brother, sister to do well. So it's been our privilege to be here and represent the Staten Island community for 25 years.